treatment. This is an amazing appliance because it actually takes a part of your growth spurt and also like it works when the child is growing. It helps to expand the arches. That way, when they grow into the ortho phase, like the regular, when they become an adult, they really don't have to go back with the retainers. I always see tons of my patients coming back with a relapse after a regular ortho case. They have to go through at least a 6 or 7 months, like a limited case, and sometimes it has to be an unlimited, and it just becomes more complicated. But when they grow with the HealthyStart, they're going to have a healthy smile, and they don't have to go back to their ortho retainers, no more Invisalign or any of those retainers in the future if the treatment is more fits for them. And then in the future, we would be like looking at a very nice smile.
One is, how does this compare to the cost of braces? And just as importantly, the cost after the cost, which means the ongoing expense of not getting it permanently fixed in childhood.
I'm a mom too. So my child is growing, and right now he's 10 years. So I have this period of still some more of his growth remaining and some more baby tooth remaining on his mouth. So I'm looking at spending less money now versus I wait and give him a regular ortho treatment where I am looking at probably quarter of the price. I might be like spending anywhere from 5 to 10 grand, depends upon his treatment in the later, or I get to do him a lesser price for HealthyStart and get it all over with. So to me, cost-wise is very affordable. That's an ongoing expense. Probably they're going to see bills almost all of their life for different purposes, like say sleep apnea, or like having to go through a relapse to go through some more ortho treatment, or like a bite collapse, or like gum issues, some bone remodulation. So it's just that you're going to have constant bills, something related to that if they miss the HealthyStart at their life. And whenever the parents bring them, they really want to get treatment for their crowded baby tooth. That's their main concern, and that's the one which really strikes them. But there are a lot more to it than actual crowded baby tooth. It's like, for example, a high arch palate, or like a lateral crossbite, or like an anterior crossbite. Like those are certain dental things which the parents don't know, but when we look at them, like we really have very limited choices at that point of time. But with me having the knowledge of HealthyStart, I'm like more happy to provide them with a complete overall treatment in that age and not to wait later at a time, too narrow. So when I look at them, I tell them, hey, I have this great appliance called HealthyStart, and this is something the kids love to wear it because it is just that it grows a lot, like the teeth will find its place in its arch with the arch being expanding. So I don't have to pull out another teeth, but the teeth automatically has their own space now because the teeth are guided. The HealthyStart guides the natural teeth coming into their arch and also naturally expand, and it's such a gradual happening. There is like, you might not even see it. It's just like a fraction of a second, or like, it's just that, hey, I never thought that had space, and now it's like awesome space in there because the arch knows how to grow because now it has a guidance. Because anything in this world, when there is a guidance, it's so easy, and that's what HealthyStart does, guidance. Because anything in this world, when there is a guidance, it's so easy, and that's what HealthyStart does. And I'm so glad that I am using the HealthyStart, that I'm not looking into some kind of dentistry where I'm going to lose arch space and putting the patient into a lot of other problems in the future. It has a lot of options and series of the HealthyStart appliances, some for habit breaking appliances inbuilt into it, some are like the bruxism, the mouth breathing appliances. So it's so nice. Trying to do skateboards, I recently got him these HealthyStart. And right now I'm telling him, you can wear that when you are skateboarding, because like every time I have to go change these mouth guards, and I just tell him like, hey, wear this while you're skating. I feel like it's a wonderful appliance in case if he's going to bump into something, that's going to shield his tooth. So as a mom, I'm like, oh, I'm not going to keep running into stores for a mouth guard, like changing the different sizes and all of that. Like as it just fits into a lot of categories, and it really works.
Adapted to using it.
He loves it. I just don't even have to tell him. He's a person, sometimes he becomes so playful, and I like the fact that they have the little patient contract, and he just like, Mom, I signed it, so now I'm going to take care of myself, and it's so wonderful.
Why do we start so young?
It needs to be started young. That's how the appliance works. The earlier we start with, that's more wonderful. I feel that I'm just doing it to my son at the age of 10. Like when I see my patients who are older, I sometimes feel that I should have started it earlier. I mean, I would have got even better results. Because sometimes when they're older, you have only less time and less amount of arch space growth, or like, you know, having the teeth move, because we have to use different...
take out, and you know, we don't want to extract teeth unless it's absolutely necessary. But sometimes it is necessary. When does that happen?
It's the same art. When there's too much of arch space loss, then they have to create more space for the good alignment of the tooth. So if that is a requirement for need of space, then as a dentist, I feel so bad when my orthodontist send me marking 4 or 3 tooth, sometimes depends how they want the case. I have to pull out really good natural teeth, the premolars most of the time, and I have to pull them out so that they can create that space to align all the teeth. This Healthy Start, like, is more and more awareness is created. Like a lot of patients had given the opportunity to use this appliance and then not to go through that extractions, not to lose their premolars anymore. So they would have like all their set of 32 teeth. You know, like I wish to have more teeth, to have more nice chewing and capabilities. It becomes more prevalent. I would say it's like it's becoming more worldwide treatment option in every doctor's clinic. Then probably none of the patients have to even go through an extraction in the long run. And no parents have to be even feel bad about, hey, I just had to go through my elder son's or elder daughter's extraction just because for ortho. But now she's going to say, hey, you know what? She's going to tell her friends, I have Healthy Start for my younger daughter. I don't have to go through an extraction anymore for her for ortho case. Is that amazing, right? Sister, I actually had to do an unfortunate thing. I had to extract my brother's anterior tooth. Anterior is a front tooth, because his orthodontist told me if he's going to extract his premolars, it becomes more crowded. This is one of the rare situations, and I know that more patients are there in those situations. And imagine me extracting one of his front tooth. So instead of having 4 front tooth, he has 3 front tooth. And I just felt like I have to do this because he needs to have a good smile. And also not because of that, his arch was very crowded. He had a lot of problems to even like chew properly, bite properly. And I was like, as a dentist, I felt way long ago, if I had Healthy Start for my brother, I wouldn't have ever had to extract his front tooth at all. I don't have to do that for my patients either. I'm so excited about this great appliance I have in my clinic. My staff are super excited, and we are having a healthy smiles with a Healthy Start.